what it is in a Mediterranean diet that benefits our mental health. It's increasing your intake of plant-based foods, and the
Mhm.
backbone of all plant-based foods is dietary fiber. Not only is it beneficial for our gut health and our gut bacteria and our gut microbiome, it can reduce your risk of type 2 diabetes, reduce your risk of coronary heart disease, and also reduce your risk of colon cancer. And in the UK, we should be consuming at least 30 grams of fiber per day, but it's estimated that adults are consuming only between 12 to 18 grams.
Caitlin, welcome to the show.
Hello, thank you so much for having me. It's so lovely to be here.
So, I want to ask you about how you view and define holistic health. What does it mean?
Oh, that's a really good question. So, when we look at the definition of actually what holistic means, it means incorporating like a whole body approach. And I think, in Western medicine, up until very recently, issues have been siloed to specific regions of the body. So, you have a gut issue, you have a mental health issue, you have a lung issue, you have a foot issue. Whereas what we're recognizing now is that the body really is this interconnected system, and the function of one area of the body greatly impacts the function of another. And that's particularly true when we're looking at gut health, with the gut now being coined our second brain. The gut is coined our second brain for several different reasons, but for the main reason being that it has its own nervous system called the enteric nervous system, which basically means it can function entirely independently of our big brain up top. So, it doesn't necessarily need signals to be able to function and digest our food and move things along. It's obviously home to this gut microbiome, which is that community of millions, trillions of bacteria, fungi, parasites, yeasts, all living within our large intestine. And we now know, because of the mountains of research coming out, just the impact that the gut microbiome can have on not only our gut health, but our overall health, and in particular, our mental health, because of the connection between the gut and the brain, known as the gut brain connection or the gut brain axis. So, going back to the question, what does holistic health mean? Yes, it means not just focusing on one area of the body, recognizing how everything is interconnected, but then also recognizing that, I stand here as a dietitian. So of course I love, talking about food, and I was trained on how nutrition and food can really impact the human body. But understanding that actually diet is just one piece of that puzzle. And to improve our health, it requires a look at the bigger picture, focusing on perhaps practices that can influence the gut from other directions, not just from what we're eating, but perhaps, how it's influencing our brain. And that's why I've started to integrate practices like yoga, meditation, and breath work, also being a yoga teacher myself, alongside the dietary management um, of gut issues, to work with my patients in a more holistic way.
And going back to that gut second brain phenomenon, then obviously we have the gut brain connection, which, as you've alluded to there, and as a conversation really in the space, is so much on the gut brain connection. What's then the difference between the gut doing its things that it does separately, and then when does it connect? How can we understand the difference between the two ways that it works?
Yeah. So the gut and the brain are in constant communication with each other all day long. And these signals are being fired back and forth. So the gut is communicating with the brain, and the brain is communicating with the gut. Now, in a healthy individual, these signals are occurring in the form of: I'm feeling hungry, I'm feeling full, I can feel food moving through my digestive system, it's time to open my bowels, it's time to go for a wee. These very normal sensations of hunger and satiety and gastric emptying. The place this kind of goes awry is when we are feeling particularly stressed or feeling particularly anxious. And the brain then starts to send signals down to the body to tell us that we are stressed. and it activates that sympathetic nervous system, that fight or flight response. And so, what happens physiologically? We get increase in our heart rate, we might get slightly sweaty palms, and essentially the blood flow moves away from our digestive organs to help us either fight the threat or run away from it. So digestion essentially takes a back seat, and that's an absolutely normal response to have. And typically, once that threat is gone and you're feeling kind of safe and sound, then your parasympathetic nervous system, that rest and digest nervous system, kicks into gear. And that's when, your heart rate slows, you're feeling a lot more calm, and the blood then flows back towards your digestive organs to help you digest the food you've just eaten and, absorb all the nutrients from it as well. But the problem we see is in people who are chronically stressed
Mhm.
or who are kind of unable to regulate their nervous system in a way where they are greatly impacted by stressful situations. And
It's fine if you're being chased by a bear, but actually
yeah,
if you're just feeling a bit stressed about work every day, then it's gonna cause issues.
exactly. And that's it. If you were being chased by a bear, you would want that fight or flight nervous system to kick in so it would save your life. But like you said, it's those like day to day tasks that are causing increased stress, which we then see an increase in cortisol, we see an increase in adrenaline. And over time, this can essentially increase sensitivity of the gut muscles, a term we call visceral hypersensitivity. So what happens is then the with this like hypersensitive gut muscles, the body then perceives very normal symptoms of digestion as a threat and results in things like pain, abdominal bloating, and often a change in bowel habits. And this increased visceral hypersensitivity is what we see in patients who have these disorders of the gut brain interaction, such as IBS, so irritable bowel
Mhm.
syndrome. What's interesting is studies that have looked at the physiological response to eating certain foods in healthy individuals versus those with IBS. So I love talking about this study. So basically, they took a group of people. Half the people had IBS, half the people were like healthy individuals, and they essentially fed those people the same meal. And then they did MRI scans of their bowel, and what they found was that in both groups, they had a pretty similar amount of gas production in the gut and a very similar amount of increased intestinal fluid. So, whenever we eat something, fluid is drawn into our bowel to help us like digest that food. So both groups had a very similar production of gas and fluid. But then when they did the symptom severity questionnaires on the two groups, it was the group with IBS who were reporting a significant increase in things like abdominal pain and bloating. And so what this study shows is that it's the increased sensitivity of those gut muscles which is triggering the pain. It's not
Mhm.
actually like an increase in gas or an increase in water.
And
It's
then the alert goes through to your brain to register it as pain, discomfort in
exactly,
that way.
exactly. And so, disorders of the gut brain interaction occur like, when we put on like a pair of glasses or we put on a watch and like your brain registers that sensation, but then after about a nanosecond, you forget about it because it's just a normal response. Or disorders of the gut brain interaction start to like notice those sensations as like an issue. And then you get this kind of vicious cycle of like symptoms and then worsening pain and then worsening stress and then worsening symptoms. And that's why practices like yoga, meditation, breath work can kind of help to break this stress symptom cycle.
So then going back to the mental health element of that, you have a stressful time and therefore you have these manifestations, these symptoms. Is that then the cause of these symptoms that increases the mental health implications, or is it mental health that causes the gut? Do you know what I mean? What I'm
Yeah,
trying to say? What
like
where
a
does it go?
a chicken and egg scenario. Which came first?
Mhm.
And we can't say for certain, and it's different in everyone.
And when you say mental health, are we talking just anxiety, which is stress a lot of the time? Or are we talking like depression or like how severe are we talking?
Yeah. Obviously, mental health is a very broad
Yeah.
spectrum. In this context of IBS and what I'm talking about, in particular, stress anxiety, although there was a study that looked at clinical depression, and this really goes to show the impact of food and diet on mental health conditions like depression. So it was a study called the SMILES trial. So the SMILES trial essentially investigated that very question, like how much can diet impact our mental health? And again, they took a group of people with clinical depression and they randomized them to one of two groups. So one of those groups received social support and counseling, which we know is a really useful strategy to help manage depression. And then the other group received sessions with a clinical dietitian, I think 3 sessions over 12 weeks. And the aim of those sessions were to essentially improve the healthiness of their diet, which involved following more of a Mediterranean style diet. So increasing their intake of plant based foods like fruits and vegetables, whole grain carbohydrates, beans, pulses, and lentils, nuts and seeds, healthy fats from avocados, olive oils, oily fish, whilst also decreasing their intake of these more unhealthy, ultra processed foods like cakes, biscuits, takeaways, fried foods. And at the end of the 12 weeks, the results were quite astonishing because the group who had received the social support and counselling, 8% of that group had achieved complete remission of their depression, meaning they were no longer depressed, which is amazing. But when they looked at the group who had changed their diet with a clinical dietitian, almost 33% of that group had achieved complete remission of their depression, meaning they were no longer depressed. And the greater degree of dietary change, the greater the improvement in their depression scores. So that massively shows how impactful diet can be at influencing our mental health. But I guess back to the question of like, which came first, the chicken or the egg, it's difficult to say because someone who suffers from anxiety and depression may have a poorer diet quality and therefore worse gut health. And then therefore that kind of feeds into the cycle. But it's difficult to obviously say which came first.
Yeah. And why does a poorer diet, so we have the processed foods, the unhealthy sugars, and all of these things, why does that actually impact? Because we know that obviously it's not good for our guts and good for our health. We might put on weight. Is it those manifestations that can impact our mental health? It's quite shocking actually that how changing to this Mediterranean diet for a fairly short period of time can have such an impact in this study. Can you talk me through actually like what happens when we indulge in these a long term of these unhealthy diets and how it can impact our brain?
Yeah. Well, I guess if it works, to talk about, I guess, what it is in a Mediterranean diet that benefits our mental health. So kind of talking about it from the flip side.
Be a bit more positive.
Yeah. So when we look at kind of what that Mediterranean style diet is, like I said, it's increasing your intake of plant-based foods. And the
Mhm.
backbone of all plant-based foods is dietary fiber. So
Everyone loves fiber at the moment. It's having its moment.
everyone loves fiber. It's my favorite F word, like I always say. um, and, fiber feeds our gut bacteria. And not only is it beneficial for our gut health and our gut bacteria and our gut microbiome, but I think an 8 gram, I think the stat is an 8 gram increase of dietary fiber per day can reduce your risk of type 2 diabetes. I forget by what percent, but reduce your risk of coronary heart disease and also reduce your risk of colon cancer. So, and in the UK, we should be consuming at least 30 grams of fiber per day, but it's estimated that adults are consuming only between 12 to 18 grams. So we're really falling short. And to increase your fiber intake, it's not too difficult. We're talking about like half a can of chickpeas, or even
Yeah.
like a handful of nuts as a snack, or an additional 2 portions of fruit per day.
Yeah.
But fiber is what our gut microbes love. And when we break down and digest dietary fiber, we produce these compounds called short chain fatty acids, butyrate, propionate, acetate being the three main ones, which are these compounds which get sent to our brain health, our heart health, our skin health, and have kind of the biggest impact. With dietary fiber, the aim is to eat a variety. So you may have heard of the term like 30 plant points per week.
Yeah.
So it's recommended to try to eat 30 or more different plant-based foods per week. That number came from a large study called the American Gut Microbiome Research Study, where they analysed the gut microbiome of thousands of people across the UK, the US, and Australia. And what they found was those who ate 30 or more different plant-based foods per week had a far more diverse gut microbiome compared to those who ate less than 10. And so you really just need to think of each different plant-based food as one point, and even herbs and spices count towards a quarter of a point, because quarter of a point just because we eat them in smaller quantities. That's what you really want to be aiming for in terms of like diversifying your diet to not only improve your gut health but also like your mental health as well.
And there's so much good, like there's recipes out there, there's so many studies. I spoke to Emma Bardwell, who just released her book called The 30 Gram Plan, and she just had really lovely recipes. Serving one portion, you don't need to feed a family of 6 every time you cook. And it had, how to get that 30 grams of protein, that 30 grams of fiber in each meal, and it's actually food that you probably would want to eat. And now it is easy to do that. You can Google things. Instagram is such a good resource as long as you check whose account you're looking at. A little bit of discretion, but it is really, really easy and the content is out there. It's just re-educating ourselves in that way and actually understanding what the difference it makes, which is why it's really interesting to have discussions like this. And I really want to ask you, Kaitlin, about your experience as an NHS dietitian, because you'll see the good, the bad, and the less good um, in that, because it's really a representation of the UK society.
Mm.
Everyone will nip into the NHS at some point. And what did you find through your time at the NHS? And what were the common issues that you were faced with?
Yeah. I mean, so I started my career as an NHS dietitian, as most dietitians do, and I would say it's the one of the best places to work as a newly qualified dietitian, because you gain so much experience across so many different specialities and you really understand how to apply human nutrition to different disease states. And, I was fortunate enough to be able to work across both inpatient and outpatient settings, specializing very early on into gastroenterology and gastrosurgery. And so I wasn't only working with patients which could consume food orally, but I was also delivering enteral feed and parenteral nutrition, so feeding via feeding tubes and also directly into the veins, essentially IV nutrition.
Mhm.
So it was like a very clinical role, and I really enjoyed the fast-paced nature of the NHS, but I did see also how overstretched and underfunded the system can be, and people often need more support or more appointments than was available um, within that setting. But I guess the NHS really did teach me the value of evidence-based care, but also the limitations when it does come to then treating more complex and chronic issues. And for me, that's why I decided to move across to private practice, to be able to offer a more kind of holistic and patient-centered approach, because I just felt like I was doing, patients a slight disservice by not being able to spend kind of long enough with them. And so, yeah, that's kind of why I'm like glad where I've ended up today.
Mhm. And were there particular, like, was it mainly diet that people would come to? Obviously, they're going to a dietitian, but I assume they would have been referred to a dietitian. Is it the mental health complications that maybe people are suffering from that then they're referred to the dietitian, or what sort of people were you dealing with?
Yeah, so it was more so on the in the acute clinical setting, like on the hospital ward, it was patients who had come in for bowel surgeries with very chronic inflammatory bowel disease, complex gut disorders. Um, but yeah, mostly like bowel surgery. So literally parts of their bowel having to be removed due to cancers or complications. People with like stomas, ileostomies, colostomies, that type of thing. I did do what we call outpatient gastro clinics, which is when I would see patients who had been referred with IBS. Um, but again, a lot of those patients would come to see a dietitian. Maybe they didn't really want to go see a dietitian, but it was kind of the next thing that their doctor would suggest or recommend. When we work with patients with IBS, we know that there is that evidence based diet known as the low FODMAP diet, which can be effective in reducing gut symptoms in up to 75% of patients with IBS. But it's a very complicated diet to follow. It's complex, it's nuanced, and many patients, especially who are from a lower socioeconomic class, do not have the facilities even to be cooking their own meals, and it can be a very complicated diet to put someone on.
Mm.
So again, you're kind of just met with this, I guess, barrier to being able to fully support patients as best as you can. And of course I would support them as best as I can, but with the time limitations that we had.
Yeah, there's a lot of limitations, I guess, on both sides. But therefore, then there's a pill for everything nowadays. Whether you want to lose weight, whether you have, and literally anything, you can get a pill for. What is your view on holistic health? And obviously, if ideally, if everyone went on a Mediterranean diet and they were able to go to therapy or anything like that. But where is the medication side coming into it? As from your background, what are your views?
Yeah. I mean, I'm not anti-medication at all. Like, prescriptions are absolutely vital for many, many conditions. Um, but we also need to explore kind of what's driving symptoms. I think again in lots of IBS patients I work with have been through the healthcare system and have just been told to try this other pill, try this other medication, try this other fiber supplement, try this probiotic.
Mhm.
And although they can help to a degree, I always suggest like zooming out and looking at the bigger picture. You can't just take a probiotic in the hope that it will put a band-aid over the problem, especially when it comes to IBS and other functional gut disorders. We need to like really zoom out and look at the bigger picture and see what could be driving symptoms. So I guess like the sweet spot is to really consider using both. So often like medication for short-term management, like for example, I have some patients with like very chronic diarrhea predominant IBS, and like using things like Imodium, that's absolutely recommended and I would encourage, just so you can kind of manage that short term and have an improved quality of life. But then using holistic tools for long term support and prevention of symptoms or management of symptoms. And like I often collaborate with doctors to ensure that patients are feeling fully supported from both angles. But I also ask, what's the patient aim here? And 9 times out of 10 they say I don't want to be on long-term medications. And for IBS, there's absolutely no need to have to stay on medications long term. It does depend on the gut disorder that someone's suffering from. Of course, for more complex issues like inflammatory bowel disease, if inflammation is very severe, then medications are
Mhm.
certainly recommended. And although diet plays a big role, it's not going to completely heal the gut. Sometimes we do need medications in the beginning, but then when patients are in remission, then absolutely the aim is to come off those medications and things can be managed from a dietary lifestyle perspective.
And tapping into that lifestyle side of it as well. You obviously have the movement side, being active. You yourself are a yoga teacher, therefore a big believer in all of this. Can you talk me through the benefits of moving your body, specifically yoga, and how it can actually not only, strengthen, tone, whatever it is that we would look for normally, not normally, but maybe historically we would view exercise as kind of separate to our mental health. And obviously this discussion has been really, really opened up in recent years of the links between that, and therefore the gut even more recently of how it can impact. But what's your view on yoga, exercise? Where does that come in your professional work?
Yeah, I mean, I, like you said, as a yoga teacher, I love recommending people try yoga.
Mhm.
And for many people, I believe they view yoga as a form of exercise. When we actually look at what the yoga practice is, it's a spiritual practice, which of course involves part of that involves moving your body in a way that improves strength, flexibility, and as a byproduct, tones muscles and makes you feel and look good. But when we break it down in terms of why yoga is so good for our health, well, of course, the physical postures and the movement, known as the asanas, and specifically for gut health, they can like stretch and lengthen our digestive organs. They can give our digestive system a bit of a massage, and again also gets the body moving. And we know exercise can increase those endorphins, those feel good hormones. That's why after you do exercise you feel like, oh my god, I feel great, I can conquer the world. So that's kind of one element of the yoga, but then another element of the yoga is also the breathing, the breath work that is involved. So often yoga is synced, you sync your movement with your breath. And the science shows that breath work can activate that parasympathetic rest and digest nervous system. So that's another reason why yoga is particularly beneficial. And then, kind of, the third reason is also then the meditation and mindfulness element that yoga incorporates. So being very present, which can again help to reduce stress and relax the nervous systems. When we look at that on a physiological level, studies that have looked at like meditating monks, for example, they did MRI scans of their brain and it showed that the size of their amygdala is significantly smaller in compared to non-meditators. And the amygdala is like that fear center of the brain. And a smaller amygdala is essentially a good thing because it means we're less likely to freak out in really stressful situations. Now, obviously, these monks were meditating for like 2+ hours a day, but this study also found that for us normal people who are maybe meditating for 5-10 minutes a day, or maybe not even at all, even if you start a very simple meditation practice of 5-10 minutes a day, you can still have a significant impact on the size of the amygdala. And so I kind of say yoga is like that perfect trifecta because it's the physical movement, it's the meditation, and also it's the breath work, which can be so beneficial on our overall health, but in particular our gut health.
And how much would you prescribe? How, if someone's listening to this thinking, okay, I love this, that's great. The thought of going to, a yoga class for an hour every evening, I'd absolutely love that, but it's just not going to happen. What is a realistic approach that you would suggest?
I suggest, if possible, to try to do yoga 3 times a week, but even for 20 minutes. So 20 minutes, 3 times a week, getting on a mat on your living room floor, simply doing some stretches, but being very mindful and present and tuning into the breath. I have some videos on my YouTube channel that people can explore, or other yoga teachers on YouTube. There's hundreds of them. And then also, if possible, trying a 5-minute meditation practice every day. And so setting a timer on your phone, literally just sitting, listening to your breath. You can put music on in the background, or lots of these meditation apps now have very like ambient, beautiful sounds that you can put on in the background. So yeah, 5 minutes of meditation every day, yoga 3 times a week for at least 20 minutes.
And what's your experience with this as well? Is it something that you've been doing for a long time, or have you tuned into it? Give us your rundown on how it's transformed your life.
Yeah, so my yoga journey started actually when I was at university. I joined the yoga society. And I was practicing yoga probably 3 or 4 times a week. But as with most people, I was doing it as a form of exercise. I felt good, it felt good in my body, I felt flexible, I felt strong. And it was only kind of when I moved to London after university, I started to really discover the spiritual side of the practice. I now integrate yoga into my daily life, but that doesn't just involve the physical postures. It involves, my values and how I show up in how I think I like to show up in the world. But for me personally, it was a couple of years back. So I think it was in 2022. I basically reached like severe burnout. So I had been working as a frontline dietitian all throughout COVID, and was just working throughout all of COVID on the front line, and then went back to trying to like run my own business on the side, and very quickly reached burnout, and ironically became very unwell with all sorts of gut symptoms. Ended up in hospital, having a camera up my bum, had all the tests and investigations. And, thankfully, all of the tests were normal and clear. And, my doctor afterwards, when he was telling me about the results, he said, like, look, you're fine. But he was like, he asked a very funny question. He said, Caitlin, like, is anyone being really horrible to you in your life? And I was like, no, like, no one's being horrible to me, but actually I'm being horrible to myself. I'm like pushing my body to the limits,
Mhm.
and I'm so stressed and I'm trying to juggle way too much. And it was in that moment that I realized, like, despite a relatively healthy diet, if I do say so myself, and with all the knowledge and expertise I had, like, my gut was still suffering. And I recognized in that moment that it was the stress that I was putting my body under, which was causing an issue. So that's when, I was fortunate enough at the time to take a sabbatical from work for 6 months. I moved myself to Bali in Indonesia. I did my yoga teacher training and lived this very relaxed, wholesome, holistic lifestyle. And then brought elements of that back with me to my life in London, and just became so much more, I guess, tuned in to the needs of my body, and recognizing that actually it's important to like make sure that your body feels safe and grounded, and how impactful that can be on like nervous system regulation.
Mhm.
So I try to, I basically want to prescribe everyone a holiday. Go to Bali. Go to Bali for a couple of months and you'll be sorted right out. No. But I'm just about to release a 7-day reset. So it's 7 days of yoga, breathwork, and meditation practices, and then a 7-day gut friendly meal plan for people to essentially reset their gut in 7 days, reset their gut and nervous system in 7 days, because it really doesn't take long to start to notice a difference in how your brain is communicating with your body, and to kind of help regulate your nervous system.
Do you think that our culture, our society, generally, if we speak specifically for the UK, um, do you think it's set up against us in a way that we live at the moment? We talk about the food on offer, the hours that we work, the daylight that we are working during and therefore not really out in,
Mhm.
the stress that we sort of impose on ourselves sometimes. It's quite fabricated, but everyone's in a rush. And when you're around people who are rushing, it's quite contagious. There's lots of different levels of that. We could even go into all of the like for effectively wearing plastic clothes if we're not careful, or the chemicals. And we don't need to go into all of those sort of things. But what's your view on more broadly, culture, society versus this holistic approach?
Mm. We co-regulate with the environment around us. So me living in London, I find myself feeling more anxious and go, 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 because that is just the environment that London is. And it's very challenging to then find those pockets of like stillness and calm and relaxation. And yes, I do absolutely agree with you in that our society is not set up for allowing us to find that space. We really have to be very conscious to create that space ourselves. And it can be very easy to become caught in the rat race of just what's going on around you. And that's no fault of the individual. That is just, a product of the environment that they are living in. When we look at other countries, for example, or other communities, other societies, there's that you might be fortunate enough to be living in a part of the world where you are more connected with nature. I was fortunate enough to move to Spain for a couple of months at the beginning of this year, and I was just constantly connected with the ocean and surrounded by trees and forests, and it does make a complete difference, not even in just myself, but in the people who are also living there. And there's a sense of community and like connection. And, people would maintain eye contact when you were having a conversation. And it was a real stark difference coming back to London, because you
Mhm.
can tell that people's eyes are like darting because you're like talking about one thing but already thinking about the next thing, which is just like completely summarizes what London lifestyle
It's
is
quite telling
about.
actually, isn't it? The eye contact, and
Yeah.
if someone holds it, if they don't, because I guess if you go back to the evolutionary side of it, it's probably to do with dominance or fear or that sort of thing. The males would lock eyes or something like that.
Yeah.
And I don't know, there's so many things you could probably break it down as. But again,
Yeah.
you can see people's brain. If you're reading, your eyes go along. If you're thinking about something, you generally look up as though you're searching for an answer
Yeah.
somewhere in the ether. But yeah, it's interesting how you can actually see that in your eyes are just
Yeah.
rushing
Or
back.
even like the thing that's come into my mind is like safety as
Mm,
well, like this feeling of
yeah.
safety.
What are you looking for? Like, is there a
Yeah.
threat?
Yeah. Yeah, exactly. So yeah, I would agree with you on that one.
Very interesting. And I wanted to talk about a bit about the hormone side of it as well, because you also have discussed how yoga, and then I guess more broadly, it would go into the mental and physical sides of it as well, can support females' hormones. Talk to me about that. What does that mean?
So all forms of exercise are is beneficial for regulating and improving hormones. Um, in particular, exercise can regulate things like our cortisol levels and our insulin levels, and also our sex hormones, which are crucial for our menstrual cycle, fertility, and of course, things like our mood. I do caveat this by saying, yoga is not the only form of exercise that can do that. All forms of exercise can help reduce cortisol. Um, but when we have, for example, high levels of cortisol, this can interfere with things like ovulation and hormonal balance. And I always like to talk about, I see a lot of women who are very physically active. So they might be doing lots of like HIIT exercises, your like lots of intense running and just intense exercise classes, which is great, especially from a cardiovascular health perspective, but not necessarily from a nervous system perspective. And I've worked with many women to actually alternate some of their workouts with, yes, still their high intensity strength training, but then maybe even some yin yoga or some restorative yoga to really get the balance right, because we can sometimes push ourselves into overdrive and push ourselves into a higher level of cortisol, which can then, yeah, impact our hormones. And also, from like a gut health perspective, we have something called the estrobolome, which is the way that our gut microbes synthesize forms of estrogen. And so when our gut health is out of sync or out of whack, then this can directly impact our estrogen levels. So that's why it's really important to again regulate our gut health and our gut microbiome to help with that estrobolome.
I've used this example before, and you've got a really stressful day ahead and you've got loads of meetings and you think, okay, great, I'll just do a quick hit workout. And suddenly, maybe you're even going to do it fasted, which for women is not a good idea. Have something, anything, even if it's like half a banana or anything,
Yes.
it makes such a difference. But yeah, and then you go in and you do it, and then you're like, okay, well, I've done that, so that's great because I've ticked it off my to-do list. But your heart rate is high, your eyes are doing that thing of like darting about, what's next, because you've not had that moment of, I'm waking up, I'm actually looking around me. You've gone from one thing to the next thing, and you can really carry that on all day. And you imagine if you did that 5 days a week, and then you had a really busy weekend because you've been working all week and you've been doing your HIIT classes, and then it just really piles up.
Yeah.
And you can really then see in that example, it's quite easy to be like, well, that person's going to get burnt out.
Yeah.
But hold
Exactly.
on, that person's us. We'll just apply it in different ways. It might not be that sort of example. but I think it's so easy to identify it because, I mean, you knew all of the information, yet you're in hospital with gut issues. You know,
True.
it's if it was that easy, we could identify it ourselves, but it's really not, is it?
Yeah, it's not exactly. And, I do find that in this day and age we're living in, we are living in a world of, the wellness industry is $1 billion industry. And we are living in a world of people convincing us we have a problem and then selling the solution, and biohacking and longevity and supplementation and saunas and ice plunges and like tracker watches and heart rate monitors, and putting all of the responsibility and the onus on the consumer, when in reality a lot of it is to do with the environment that we're living in. Like we said, it's to do with like larger corporations and industries, and if they could change the way that things are set up, then we would all be, I think, happier and healthier. And I mean, this is maybe a topic for a conversation for another time, but like this is why I have a slight issue even with like all of these trackers and tracker apps, because the work I do with patients is to get people to feel into their bodies and work more intuitively with how they're feeling. And often these trackers and all of these supplementation protocols that you can follow takes you out of your body and focusing on something else.
What quite frightens me is the overconsumption from a personal perspective, but then more broadly, you can see it in other people as well. And I think that your point of all the trackers, I briefly had a whoop, and it was just, I was like, well, I don't need all of this information because I know when I've slept badly.
Yeah.
I know when I'm going to get ill. Having done a lot of exercise in my life, I would say I'm pretty in tune. Sounds quite cocky to say it there, but like,
No,
I've
that's
worked
good.
on that,
Yeah.
and therefore you're outsourcing it to this other metric, which is very intelligent, very scientific, and works really well for some people. But it's just actually thinking, hold on, does this work for me? What am I going to do with this information? Am I actually going to change my behavior with this information if I feel fine? Probably not. Like realistically, if I feel fine, I'm probably going to carry on and keep doing things. And at that point you think, well, it kind of goes back to the intuition side of it. And I just think that the overconsumption on Instagram alone, you can interact with how many accounts in 10 minutes? Like if you're watching reels for 10 minutes, say, you have bombarded your poor little brain with so much information, and it's really fun, it's really entertaining and really addictive. It's super, super clever. But people, if you suggest going for a car journey with no music on, nothing, some people react in quite a not aggressive, but like, oh, what? Like, I could never possibly do that because there's almost this fear of sitting with yourself
Yeah.
and just being.
Mhm.
And I think that the frightening element of like the consumption cycle, and then it goes into clothing, and our houses are full of stuff that we don't even know what it is. If anyone's moved house, you just think, oh my goodness, what is all this stuff? And yes, a lot of it is just stuff that we need, and we're amazingly blessed to have all of this stuff. But there is such a line, isn't there, of more, 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 and you need to get new clothes for this whole season despite your old clothes being fine, and
Mhm.
just more, more, more for everything. And it really just clutters our brain up and does the metaphorical dash between what am I looking at next as well. It just is such a cycle that is so hard to break off.
Yeah. I mean, we live in a world of overconsumption, and whether it's material goods, whether it's whether it's data, we live in a world of overconsumption. And like you said, touching on that point of like, you can get all this data, but then it's like knowing what to do with it. And like that's why I really try to focus on like a zoomed out approach, because you can have this data, you can be buying these products, you can know that your sleep was bad the night before or good, but what's your weekly diet looking like? What's your sleep looking like? What's your relationship with yourself looking like? What's your relationship with your work, with your finances, with your family? All of these things. Like, you can take a pill, fine, if that makes you feel better, but like zooming out and looking at the bigger picture is where it's really at. And unfortunately, that isn't a very like sexy answer. People obviously want a magic pill to fix things and they want to be able to focus on a certain thing. But yeah, my advice is always to like zoom out and look at the bigger picture.
And I was going to ask you a question, but I feel like I've already answered it myself, which is great because it means that you've actually answered it. But it was just about the different types of exercise. So I would be a lot more like a cardio gym person rather than yoga. But recently I have incorporated a bit more yoga, and it mostly for flexibility reasons. I've just been able to do that. But then it's interesting the mental side of it that you bring into as well. Because you know that bit at the end, I'm so sorry, I don't remember what it's called, but when you lie down on the ground,
Shavasana,
Shavasana,
the best part. Yeah.
best part. So I like occasionally I'll convince my husband to do yoga with me. And by the point it gets to Shavasana, he is up and out. He's like, I'm not interested in this. But see, when you actually do it, I think when you're doing it at home, it's different to when you're in a class because it's really, really lovely in a class.
Yeah.
But see, when you actually lie down and do it, you do actually feel so much calmer. Again, as you say, do it for 20 minutes. And it really makes a difference of just connecting with, hold on, okay, I'm stretching here. And then, maybe in 10 seconds, I can actually stretch a little bit more and you can feel that. And obviously, all of these, wonderful yoga teachers actually point out what you should be feeling as well and what
Yeah.
perhaps you shouldn't be feeling if you're not very good at it like me. But it's actually such a difference of something that actually has a bit of mindfulness. And it's not necessarily mindfulness, it's just space, isn't it, as well? Like just taking that space. And I guess you'll have to be really careful about like your tone of voice and everything when you're teaching because you're really dictating that space.
Yeah, absolutely. And I mean, it's just about, as a yoga teacher, it's just about holding that space for people to find stillness.
Yeah.
And absolutely, tone of voice matters. I'm not going to be like shouting at the top of my lungs in a yoga class.
Right, everybody, up we go.
Yeah, exactly. Whereas you compare a yoga teacher to like a HIIT instructor, they'd be like, yes, team, let's go, like, clapping their hands, like loud noises, really positive, positive language. And like a yoga teacher obviously uses positive language, but in a softer way. And
Yeah.
I think, yeah, that's it. It's about holding the space to be able to find, to be able to allow people to find stillness in a way that they feel safe to do so. And it's interesting that you compare obviously an in-studio yoga class to doing a yoga class at home.
Mm-hmm.
I am a firm believer of when you're in a studio class, there's that collective like energy of everyone in the room, and knowing that you're lying here in Shavasana for 5 minutes and so is everyone else. Whereas when you're at home, you might think that no one else is doing
Dishwasher's
it.
done. I need
And
to
the
go and do that.
dishwasher's done, I'm going to do that. My
Yeah.
dog's going to walk into the room or whatever it might be.
Yeah.
And again, that like feeling of perhaps safety, like there's a safety element of like knowing you're in a room with like a teacher who's facilitating a session versus at home, you might not feel that same safety.
And I think when in any class that I've done, when there's that acknowledgement of, okay, you've taken this time for you, this is your workout. And it's always kind of cringy when you say it out loud, like out of context. But at the time, it really works because it's like, okay, you can do this advanced pose, but also do what you are actually feeling because it's your workout, it's your time. If you need to just lie down for like another minute, it is your thing. It's not at work, it's not an obligation. Like it's supposed
Yeah.
to be something that makes you feel good or will make you feel good or you're doing for yourself. It's an investment in yourself.
Yeah.
It's not some work thing that you're going to have to go to a disciplinary because you lay down for an extra 30 seconds in child pose or whatever.
Yeah, exactly. And there are many different yoga teachers out there and they all have different styles. So you will get some yoga teachers who are very like anatomy focused and mobility focused, and they are more about, strengthening and lengthening. But then you also get certain yoga teachers who are more about, um, you know, more spiritual, or allow that space for you to find stillness within your own practice. And like one of my favorite yoga teachers, Mona, she is all about that. And she encourages you to skip parts of the flow if you've lost connection with your breath, and actually sit in a child's pose to recenter and find your breath again, or, skip a vinyasa and actually just do some cat cows,
Yeah.
because it really is about tuning into what your body needs in that moment. And staying on your mat, staying in your lane and not being like peer pressured into thinking you must be doing like XYZ. And that's why I just love yoga as a practice, because you can apply everything on your mat to the real world.
And to close off, what would be something that you would want people to take away from this conversation as their final point? Okay, everybody, now's your time to tune in again. What should they take away from it? What would you like to stress? Maybe stress is a bad word to use.
No
This
pun
conversation,
intended.
emphasize.
Emphasize. Yeah, we want to stress no stress.
No stress.
My takeaway would be that improving our health, in particular our gut health, is so much more than just what we put on our plate. It requires a holistic approach, looking at, yes, absolutely our diet, but also our mental health and our nervous system health. So, how our brain is communicating with our gut. And if people can do one thing after listening to this podcast episode, it would be to explore a meditation practice of 5 minutes a day, and or a yoga practice of roughly 20 minutes 3 times a week.
And leading very nicely on, Caitlin, where should people go to find you? Any of your content, work with you? Where should they go?
So the best place is probably my Instagram. I'm known as the Mission Dietitian on Instagram, and there you can find all links on how to work with me. My website as well, www.themissiondietitian.com or .co.uk. I work one-to-one with clients, so if you're interested, get in touch. I host workshops in and around London. I host gut health yoga retreats. The next one will be in May 2026. I'm just about to launch a new online 7-day gut reset. So keep your eyes on my Instagram and website for that. And also then signing up to my newsletter, which you can do through my website as well, just to keep up to date with the latest events and goings on at the Mission Dietitian.
Amazing. I'll pop those links in the description as well so people can have a little check out of that. And thank you so much for this conversation, Caitlin. What a lot we've covered and a lot to take away and process.
We have, haven't we? Thank you so much for having me. It's been so enjoyable.